Oh my goodness.
Hey, Art.
Look at who is back. We're back, Mary
We're
Beth.
back, and I know they missed us, but
I know they did.
they've been doing Relias,
That's right.
and they've been really busy in Access.
Woo.
So, but I heard them talking the other day that they really have missed our dynamic duo.
We are back, and you can see we're full. We're peppy. I'll say we're peppy. We got a little pep in our step. Hey, I want to thank you all first just for the Reliance training. You know, we've been giving you time, everyone the time to complete the Reliance training. We know it's a lot, so we got that done early so we can check that off. We're going to go over some other trainings and stuff that are due kind of here in June. So a lot of this is more like just kind of information sharing. It's getting us back in the groove of things, but we are so glad to be back, and we'll just continue with our weekly updates and things like that. So, you know, for this week, we're always starting with the 13 tools, and the one that we picked was Corpus, which is one body.
One body.
You know, we meet with Mr. Burks just about every morning, and it's always about that one unit, one team, a corporation, one body. And so we really do want to emphasize it. You know, we're working on towards the same goal of best supporting our consumers. But then going a step further, Mary Beth, you were talking about how to be a good partner. So like we're one body, yes, here at the HCI, but being a good partner. So talk about that.
And in Access, we have multiple partners. Let's name a few. We've got the emergency room at Union Hospital. We've got VCOP. We've got child and adolescent. We've got all the outreaches, okay? We have the Terre Haute Police. We're going to be having the Vigo County Sheriff next. We've got the judges, okay? And we've got IPU. So the important piece is that we are working well with all those partners. And when something does happen and it doesn't go the way that, you know, is set in the protocol, or you're thinking, that's not the way it was supposed to go, then, you know, Art needs to know. You know, you can share it with Art. If I'm around, you could share it with me. But it's really important that we are being good partners to one another.
That's right. And, you know, we even have internal, because like within the body, we have good partners as well. Because, you know, on a daily basis, we're communicating with the ACT team. We're communicating with CAS. We're communicating with upstairs, IPU, Christy. I mean, there's so many just internal. We got internal partners, external partners, and we just thought it was important as we are rebooting like our weekly updates. We just want to be good partners.
We do. We want to know, we want to be known as, hey, that Access team, they're great to work with.
That's right. And they're caring too. Don't we care?
Yes, absolutely. Absolutely. You know what question I always like to ask for our partners? Is there anything else I can do to help?
That's right.
Do you have everything you need? What can we do to help? Just one of those little sayings goes a long way.
It really does. And you know, some of our partnerships, they're building momentum.
Absolutely.
Like over time, like just yesterday, it was just yesterday, like with the Union ER, we got a chance to give an update on the stuff that's just going on with the CCBHC grant, Mobile Crisis Unit. And that was a mandatory meeting. So like literally the mandatory meeting for Union ER, we were provided 15 minutes of time where we were able to answer questions and give an overview of the work that we're doing with the CCBHC grant. We want to be good partners. And then it's building. Next month, they actually want to invite Grace Clement.
Oh, awesome.
And then who knows maybe the next month we may have them invite the ACT team.
Yeah.
And I mean, it could just keep going.
It keeps going.
Keep building. So like all of these things, it goes back to this 13 tool Corpus, one body, corporation. That's what we're about. And we really just, you know, if any of you all know either me or Mary Beth, we're all about what can we do to work together? What can we do to help us work together better? So we just wanted to start with it.
So, and you know, when someone calls and they ask for Art, or they ask for Adiza or Kelsey or anybody, you know, who else, Art?
Hey, they may ask for an access specialist. So
Yeah.
they may ask for Amber.
Amber.
You know, Amber, I get a couple calls a month about, is Amber there? No, she's not here right now. Yes.
So when they call and ask for you specifically, that's telling us that you've been a good partner.
That's right.
I witnessed that on Saturday with the DISA. I witnessed it with Kelsey. I witnessed it with everybody in Access. So just keep doing what you're doing, making sure that we're really taking care of that partnership and giving it a lot of TLC.
And you know, the thing I was just thinking, so like we have a new citizens program is a good partner. Internal, like we have Shauna Fry working with us. She's doing an excellent job. And so they're just kind of all kind of new partners and new partnerships. Even with CAS, like we have a Kim, what is Kim's last name? Smith. Kim Smith from CAS. She's with us now on Fridays. It's like all of this is just continuing to build.
And then not to mention public safety.
You got it.
So I have an action step.
Let's hear it.
I named 5 partners.
That's right.
5 partners. And of those 5 partners, one that you think you could improve working with.
Yeah, so just think about it. And we've actually given you a list, but if you can't rewind it again. So
5 partners.
The action item, 5 partners, and which one
one could you improve upon?
That's right. I already know which one because we're going to talk about it a little bit later. Here, so.
All right.
And now this leads us to the next thing, and this is how these partnerships grow because all of you, so this is CCBHC, and this actually impacts everybody. Everybody knows the CCBHC grant. It ends, a hard stop, April 30th, 2022. But guess what? We are working really hard just so that all of our work is going to keep continuing and flowing. So I'm really happy to share with you literally this week, actually, I think it was yesterday, there's a national bill that's been proposed and it's already been endorsed by both political sides, which is rare in this very day and age, to look at the potential for permanent funding for the CCBHC. So just think about that.
Yeah.
2 years ago, was this even on the radar?
No.
It wasn't like, I know I wasn't even here 2 years ago.
No.
So like, were you even thinking about this?
No, I didn't even know what CCBHC
Yeah, nobody even knew what it stood for.
No.
And so like literally the bill has been introduced and it's already been kind of fast tracked to the Finance Committee in the US Senate. We have one senator, Todd Young, who sits from Indiana. He's on that Finance Committee. And it's all in the preliminary stages, but the reason we're sharing this is the work we're doing, it's building momentum at a very, very high level. So we're going to keep an eye on that bill, but it just helps, it sends a signal. Like if you're a lighthouse, right, and you're on that, it's sending a signal, hey, that lighthouse, that light is about to turn because there is a signal that national support for what we're doing on the CCBHC end is built. We don't know how it's going to turn out, but we do know it's been introduced and we're going to keep an eye on it. So we're going to keep giving everyone just kind of updates on it. We're working with Ben Bennett on it. And actually late after this training, we have a conversation with our mentor organization, Tri-County Mental Health Services. So just want you all to know, we have it on our radar. That is our job. We want to keep this work going. We have so many great people that are employed through this grant. And we just want to make sure that it's a firm footing, just looking forward. It's like you're on the beach and you just see it extend just for miles and miles. So that's what we're trying to do.
That's awesome. And that reminds me of this legislation reminds me when John Kennedy years ago developed the community mental health center model.
Wow.
And that's how that started. And look at us now. So that CCBHC is actually taking the same footsteps.
It's building momentum. I mean, and it really is fast track. There was no way anyone would have anticipated, because you have state level grants and all that. You don't anticipate it that's going to reach that level
Not
this
to the
quickly.
Senate. No.
I mean, literally, probably in less than 8. This has happened in probably over less than 18 months.
Yeah.
So, so we just want you to know we are working on that and keeping a pulse on it day by day. We're looking at grants. But we just want that nice beach. You can look along the water. You got just, oh yeah, that's the CCBHC there. That's us. So we're going to keep on it. All right. The next thing, Mary Beth, you want to talk about the employee kickoff? Yeah.
This started several years ago. And it's really a fun time. It's a chance for all of us to get together. You know, they give everybody t-shirts, and downtown Terre Haute looks like a sea of either orange or green, whatever color they are, t-shirts. Basically, you show up early in the morning, pick the nice place you want to eat for breakfast, have breakfast with your employee friends, your teams, and then we get together for probably a couple hours of motivation, inspiration, and just talking about all the good things that Hamilton Center does and the things that we have to look forward to in the next fiscal year.
It's a great way. I haven't been to one myself. I've heard a lot about it.
Prizes.
Yeah.
One time I won a stereo system.
Really?
Yes.
Oh my goodness.
Yes.
Did it have like a record player on it?
It was a good one.
It was a good
one. And people win bikes, they win trips, they win gift cards.
That's right.
It's big, guys.
It's good. And so I sent a question to Todd Pepperworth, Chief Human Resources Officer. I was getting clarification on who is required to attend and who is working their shifts. And so this is the answer I was given. And I know we already have at least one, maybe more volunteers that say, hey, I'm willing to work here on the shift. So the answer question I asked, is everyone required to attend that's in the 24-hour setting that is not on their shift? And he said, yes.
Yes.
So I'll say that again. So I asked Todd Pepperworth, I just asked him, if you're not on shift that day, are you required to be at the kickoff? The answer is unequivocally yes. So please make a note of that. Now, if you are on shift on that day, you still get a chance to order the breakfast. And I'll send an email on that for those that are on shift, and then I think it'll be delivered here. And then I've already received I think one, maybe more volunteers that say, hey, I'd be willing to work on that shift. So we'll get clarification on that. I already know who the volunteer is, if there's anyone else. But once you're scheduled on your shift for that day, you still will have the opportunity for a free breakfast. It'll just kind of like be delivered to you.
Yeah. It's to go.
It's to go. So just hope that has clarification. If you have any other clarifications on that, just send me an email. We'll get the best answer from Todd Pepperworth. That's our authority on that. Any other comments on that?
No, just show up and show out.
That's right. It's just a fun time. The next thing let's talk about is this operations video. And what I want to just do, I just want to review it because this is another just simple, very simple action item. And this is coming from our operations department. This is required of all staff. So this is the email that Jim Recker sent out. There are 2 new training videos on the intranet. The first video is the annual emergency preparedness training video, and it tells you how to get there. But here's the key thing. When you have completed the test, scan the test to HR Docs no later than June 25th, 2021. That is next Friday. And so please, this is the only other step I would like to add. Once you send it, some of you may already done it already.
I saw some people doing
it. They probably already did it. Please send me an email, or you could CC me on the email that you send to HR Docs. So actually, that's probably the easiest thing. If you've already sent it to HR Docs, just send me an email confirming, yes, I've already sent it. But for everyone else, once you complete it and you send to HR Docs, just CC me on the email so I can check you off internally. So I could just get confirmation for that. So that's a very simple action item. Once you complete it, CC me when you're doing the HR Docs as well. So I just have confirmation and we'll check that off. And you do have to the 25th to get it complete. What happens if it's on the 26th? That's not good. No, don't do that. Just don't do it.
It's not worth it.
Yeah, it's not worth it. So just get it done by the 25th. And I don't think it's that long.
Oh, no.
No, it's pretty simple.
No.
So wanted to go over that with everyone. Let's see what else we have on our welcome back agenda. Oh yeah, the partnership with Terre Haute City Police. Actually, no, I'm skipping ahead. Let me talk about the mini grant.
Okay.
So here's one thing I do want to point out. This is for all CCBHC access staff and all that to know. So there are some processes and procedures and maybe even some roles that will begin to evolve and change beginning June 30th. And they are related to a mini grant that we have received with the CCBHC grant. First, let me just quickly go over what the mini grant is. It's a small grant, but it actually puts us in good position. Remember that national legislation I was talking about? So they actually did a nationwide competition. There were 70 organizations throughout the country that applied. They selected 20. So we were a part of those 20 organizations throughout the whole nation that received this mini grant.
And you know what? I think that's a proud moment.
It
because
is.
We almost didn't apply.
We sure did. We almost didn't
know.
apply, but we did.
We did, and look where it's going to take us.
It really is. It's going to help us as just with the national legislation and all of that. And the focus of the mini grant. So here's one thing. You know how we have the acronym CCBHC. What does that stand for, Mary Beth?
Okay, a community.
No,
wait,
Yeah.
Okay, I got a
CCBHC.
Comprehensive.
No. It's Certified Community Behavioral Health Clinic.
Okay. I just, you know what? I gotta see the letters. You didn't have the letters.
Yes, no, I get it.
Certified Community Behavioral Health Clinic.
So just like we all know that, including Mary Beth, this GHI is the other new acronym.
Oh, GHI.
And so this is the thing. It's like, you know how things you get kind of settled and like, oh, isn't this a great place to be? Aren't things comfortable? Well, guess what? Things are about to change again. Yep. So I want you to all know things are changing. So be ready for some changes, and they are related to the General Health Integration Framework. Now, the shorthand, what's the purpose of it? Right now, within just kind of the field of health, there's a big gap between behavioral health and primary care. It's basically how do we bring them together to work?
Absolutely.
And we already here, we have a Grace Clinic right there.
Yeah.
And so that we have lots of opportunities to bring together the behavioral health piece and the primary care piece. So if someone asks you about the GHI, that's what it's about. Yep. Bringing together behavioral health, primary care. That's the quick summary. The thing with this grant is so we meet 2 times a month, and what we are working on that is actually related to your specific positions, I just want to go over specifically, and I went over this with the nurses before. So this is just kind of a rationale of just kind of what we're trying to do. When we're looking at the people that we're dealing with, on average, their lives are being cut short 10 to 20 years.
Absolutely.
So the idea is if there's better integration between behavioral health and primary care, we can begin to make a dent in this 10 to 20 year gap. But the specific thing that I want to share is kind of this, and this is what I reviewed briefly on our CCBHC nurse training. So right now, we have care teams. And they are primarily within that are integrating kind of like both of these areas. You have like the ACT team is kind of like within the CCBHC grant that has a nurse that is specifically assigned to that ACT team. So as part of this mini grant, there's one indicator where the care team, where it originally is just kind of the provider, the patient, and the family caregiver. The goal over the next 12 months for all of our CCBHC consumers is to start to better integrate how our nurses are playing a role. And so there's going to be a more comprehensive screening of A1C, of blood pressure and diabetes. And so we did a training so that all of our nurses would just receive that. And we are still working out the workflows. I meet with Mark and that team this Friday, but information is going to be coming out. But the goal is in 12 months, we want to move up. Right now, nurses are not in this particular indicator where we are, but the next level, the nurse is the key part of the care team. And who's that for? It's not just for ACT team members, it's for all CCBHC consumers.
That's awesome.
So it's something that is really starting to bring together the behavioral health, and the primary care in a gradual way. So changes will be coming. Just be ready for it. I wish I could tell you what I'm on now. I don't know what they're on now.
You know
We're going to
what?
figure it out.
We have lots of opportunities.
Yep.
I walked a client down this morning to Grace Clinic
Yep,
because he didn't have a primary care.
that's right.
You can literally, if they're going on an outpatient referral before you leave and they don't have a primary care, you can literally walk them down the hall and do that warm handoff and say, so-and-so would like an appointment to be seen for primary care.
You got it. And so here is the thing that, here's like the specific action item that's just to remember with this mini grant. So the threshold to move from this level here, which is beginning to the next one, is 70% of all of the patients that we see on a daily basis. And so this would be CCBHC consumers. We are doing this for 70% of them on a daily basis. And so we're going to work through it. You're going to hear more about it, but just wanted you all to know some changes are coming. They're related to this mini grant, and the mini grant is helping us with the national legislation. And that's for that smooth beach, that
Yep,
CCBHC on the water. So just wanted you all to know that what the action item is, and I said what the threshold is. What is the threshold that we're working towards for the percentage of CCBHC consumers that would meet this care team? If you missed it, just rewind it. All right, so we'll go to the next part. And then on here, oh yeah, partnership with Vigo County. So we got more changes occurring.
Yep, July 1st is a big date.
July 1, write the date down. So right now, you know, we have a great partnership with Terre Haute City Police. We started it in March. We've been ramping up. Our mobile crisis runs are going well. And we are in constant communication at least every 2 weeks with Chief Keene from Terre Haute City Police. That same exact partnership is now going to branch out to Sheriff Plassey and Vigo County Sheriff's Office. So that means all suicide calls, all behavioral and mental health calls, they're going to go through that filter, our screening from all the Vigo County. So the footprint of the mobile crisis team and access services and all related kind of CCBHC services. I'll say that again, all related CCBHC services, they are expanding now just from a city focus to a county. And there's a whole marketing effort that's going to go around it. That begins July 1st. So with that, that's why we're aggressively trying to hire the positions and try to get as much staff as possible. But just wanted everyone to know July 1st to be here before we know it. That partnership is ramping up. And it's for all the Vigo County. Right now, a lot of our work with the grant has been concentrated around the city. So just wanted you all to know that as well.
So what do I do if I get a call from a deputy sheriff with Vigo County?
Well,
What do I do?
Yeah, that you just say, how can I help? That's, I mean, it's very simple. How can I help? That is
the information.
That's right. We take the information and then we just move it from there.
Yep.
And you know, one of the things that we're getting to next, which is these bedside manners things that we're going to talk about. So did you have another question though, just related to the partnership?
No.
Okay, got it.
And you know, we're gonna have to be on our toes.
Yep, we are.
Because we want it to go well. And
Absolutely.
the feedback we get, we want it to be positive feedback.
That's right. And so we get feedback from the Chief Keene's office at least every 2 weeks and sometime in real time. But this next topic, which is related to bedside manners. And so the reason I chose that is because normally when you hear that term, you're thinking about what are their doctors' kind of bedside manners with the patient. And I chose that on purpose because literally the only type of people who need to know how many beds we have are like clinically related. They need to be like, if it's the Union ER, there's not any other organization outside of this that needs to know how many beds we have available at any time on any call. So like, if we get a call and hey, you look at the board and, oh, okay, we don't have any beds available, you don't even need to say it. Don't say that. We just say, how can we help? We want everyone to know for the calls that are coming in, because even if we don't have beds available, we have the ability to refer it. And talk more about that.
Yeah, that is what is near and dear to my heart.
Yes.
Because if we tell someone on the phone, we don't have beds, okay, that keeps them from coming in and getting assessed. Okay, and then they may not go anywhere at all.
That's right.
So it's very important that we at least get them in the door. They may not even need admission. Okay, but our core business is assessing people and determining the level of care. That's our core business. So we have to be able to show that we have an open door, whether we have beds or not.
It doesn't mean it's not even relevant.
No, it isn't relevant.
Yes.
And we can say, come on in, we'll complete an assessment, and then we'll see how we can help you. So always open that door for anybody coming for an assessment. Don't worry about the bed situation.
That's right. Just don't, and especially don't communicate that out.
No.
Unless it's like coming from a union ER or another place where they're, hey, that's clinical. We don't need it outside of that. So we've received feedback from the Cherry-Host police that they have received that message on a couple of calls, and they do not need to, it's not even relevant to their call. So if they call in, it's just, how can we help? How can we help service you? So the action item on this is very simple. Is there ever a time where we are going to be sharing, hey, we have our bed status to anyone that is not clinically related? Very simple answer on it. So that is the action item. Just go forward with it.
Hey, one more little tidbit here, because this is sometimes happens. People call and they'll want to come in, and we may have 3 or 4 people ahead of them.
Yeah.
They don't need to know that.
That's
they
right.
don't need to know that we have 3 or 4 people waiting and we have 2 or 3 admissions coming. No one needs to know what's going on in the background.
They just don't.
No.
And we're, we know we're feverishly working to try to get things in the best position we can. We know some days we get swamped. We just do our best to stay focused and just provide the best support we can for our consumers.
And the good thing is everything passes.
It
know
does.
what night was that you were here?
I forget. I don't even know. That's what
It
was a blur.
And then you literally forget about it.
That's
and move
right.
on. It takes you, you shake it off and you go back to what you're doing.
Yeah, you just dust yourself off. I think it was Monday. Yeah, was it Monday?
I don't know.
But guess what? I had forgotten because I just moved on.
You moved on. Absolutely.
I'm just like, I don't know what day.
Yeah, he's not telling war stories. He's
Yeah,
not doing it. Just moving on.
Just move on. So just want to make that clear. And that's why I chose that bedside manners, because that's clinical.
It's a good one.
If it's clinical, okay. But if it's not clinical, they just don't even.
Yeah, but that bedside manner goes with everything we do. Answering the phone.
Yes.
Okay. Greeting patients.
Yes.
Offering drinks, snacks.
You got it.
Checking back on them.
Yeah.
Just telling them we're glad they came in.
You got it.
So.
Good. Now let me give you an update on our open positions. So we have a contingency offer that's been accepted for 1 access specialist. So we're just waiting on the start date for that person. We still are searching for 2 additional access specialists. So we are aggressively doing that, performing the interviews and all those kind of different things. So we are out there, we're shaking the bushes. So because we want to fill all 3 of those access specialist positions. And then we also have a part-time peer recovery specialist that we're working on as well. So in addition to that, even on the ACT team side, we are also looking at how the 2 positions that we have open for that, our strategies for getting more candidates for those positions as well. So we really are aggressive, and we are going to get these positions filled, especially with this national legislation pending.
Yep.
So, this was more of an informational type of session today. Just wanted you all to know, hey, we are back. We are back in business. Thank you so much for the Reliance training, getting that done. It doesn't feel good to just have that done.
It's just like, I felt so good when I got those done.
It's just, it's done. And so the June 25th is for the operations, which is simple. And then you'll have plenty of time to respond to this as well. So we appreciate everything.
Thank you.
Everyone does. We appreciate everyone that works with us on all different areas. And we will see you next time.
Bye-bye.
Bye. All right.